Welcome to Hear Something Good on Women's Health and Longevity. We are so grateful to our partner, Always Discreet, that can be found at Walgreens, the women's well-being destination, supporting every stage. Together, we're bringing you something good each week on women's health, and it wouldn't be possible without their support. Today, we're talking to integrative medicine specialist Dr. Karen Koffler on a topic that doesn't get discussed enough, but it's much more common than women may realize: bladder leaks. The good news is that there are effective strategies and products that can help women manage symptoms with comfort and confidence. Dr. Koffler is a professor of medicine at the University of Miami School of Medicine and a physician at Lifespan Medical with an emphasis on longevity medicine. She also has her own private practice focused on women's health and longevity. Welcome, Dr. Koffler.
Thank you. Good to see you again.
So today we're going to talk a little bit about something that happens to many women, although a lot of people don't share that. And that, of course, is bladder leaks. What are bladder leaks, or also known as urinary incontinence, and how common is it?
Well, really very simply, it's the involuntary loss of urine when you're not intentionally voiding your bladder and there's essentially a leak. And it's actually far more common than people realize. So, for instance, just focusing on older women, about 50% of us over the age of 60 will experience bladder leaks. But actually, if you look at younger women, even as young as 18, almost 1 in 4 women actually experience bladder leaks. So it's actually far more common than people realize.
It's true, as you said, that it happens in younger women. Does it likely increase with age, or is it across the board?
So it is across the board for a variety of reasons. For instance, postpartum, very often women will experience incontinence, urinary incontinence. But clearly, we do see the greatest increase in urinary incontinence in women who are older. And there's a variety of reasons for that.
And I know that, menopause has a big impact. But I do think it's interesting to know that even sort of younger athletic women, young women, even pre-pregnancy, pre-childbirth, also experience incontinence.
Firstly, I think it's important to understand that the bladder, the uterus, and the rectum are held up by the pelvic floor, which is a key part of our core. You know, we all talk about the core. In Pilates, they're constantly talking about the core. And a key part of the core is the pelvic floor, which actually looks like a round hammock. And women may not have a strong core, a strong pelvic base in that way, and you can be old or young and suffer from that. But certainly any trauma, for instance, childbirth, which completely stretches that tissue, both the muscles as well as the ligaments and tendons supporting those tissues, or surgeries can interfere with the strength of those tissues. So it really is a broad spectrum of ages that can ultimately experience urinary incontinence.
And sort of the overactive bladder signals that some people get, like I think, as you mentioned, when the pelvic floor is either stretched or not strong enough. What's that about?
So, overactive bladder has a lot to do with the bladder muscle tissue, which is called the detrusor, that becomes hyperactive. It's not responding to signals completely right. It's innervated by a nerve called the pudendal nerve, and that can change over time. It can be less responsive to sort of like a reflex, the way someone's reflexes are not as sharp, the pudendal nerve might not be as sharp. So for things, simple things like a cough or a sneeze or jumping, the detrusor may actually contract and release urine that way. So there's it's understanding the anatomy is really important, and understanding why someone's affected by this, and this is where experts can really help women control this issue.
So we have the weak pelvic support on the one hand, this overactive bladder signals on the other hand, and it's happening across life stages. But what happens in menopause in particular that seems to sometimes, at least, exacerbate things?
So as we age, there's a quality of sarcopenia or muscle loss that's inevitable in all of us. And because the pelvic floor, which is supporting the bladder, is a muscle. It's a series of muscles, actually. There can be a weakening just by age. But add to that the loss of estrogen. Now you have some fragmentation of the collagen, which helps the tendons and ligaments remain strong. There's a fraying, essentially, of those tissues. There's also estrogen receptors lining the urethra and probably the muscular tissue as well. And so the loss of estrogen during menopause really affects several layers of what would otherwise be a more sustained tissue with stronger base. Um, so through the loss of nerve impulse, through the pudendal nerve, through the loss of muscle integrity, and through the loss of the connective tissue, all mediated essentially by a loss of estrogen.
Makes a lot of sense. But I love to talk to you because when we do talk to you, we learn that so many things are uh, very typical, happen to everyone as the normal part of aging, or just as a normal part of our anatomy. So I think it's so important as you break it down for us. What can we do, right? I think, as you mentioned, it happens at all ages for different reasons. But what strategies can help women manage mild or occasional bladder leaks so they can, feel like they can go about their life and not be interrupted?
Well, first, we know that women who are exercising through midlife and beyond tend to have less incidence of bladder leaks or urinary incontinence. So, once again, exercise as an important medical strategy to keep bladder health intact. Weight loss. So obesity puts undue pressure on the pelvic floor, and that increases the tendency towards incontinence. So getting to your ideal weight is important. Uh, there's a whole field now in physical therapy devoted to pelvic floor and improving pelvic floor function. And that's a simple referral to a pelvic floor physical therapist. And they can really assess in you what is the issue and give corrective exercises. And they do incredible work. Um, Being on estrogen improves the integrity of those tissues, particularly if one is on vaginal estrogen, which really acts locally. So, having a conversation with your GYN about the applicability of vaginal estrogen to help secure those tissues better. Um, Practical things like not drinking excessively before you go to bed at night and timing, when you go to the bathroom is an effective strategy. And then if leaks do happen, there's really very effective products that can help a woman not feel like she has to be bound to her home or to her place or to a bathroom because she'll suffer a leak and have no recourse. So there's all kinds of pads that are actually quite different from those that we use in menstruation in that they really absorb fluids better and neutralize odors, so women don't have to feel ashamed or uncomfortable if they do suffer a small leak.
On that note, I think the emotional impact or the emotional side of incontinence and bladder leaks is very real in a lot of women. What can we do to address that? Because I think a lot of these things, as we mentioned at the top of the conversation, is people keep this a secret. They feel that they're sort of alone in this, and they're embarrassed about it. What can we do on the emotional side to help all of us recognize that this is a pretty normal occurrence?
I think it is exactly that, Kim. I think it's, just like we've had our cycles, and we'll have our periods, so we're a little different at those moments. We can have leaks, and it is actually quite common. line up 3 of your girlfriends, and one of y'all is probably suffering from some degree of urinary incontinence. So recognizing, number 1, you are so not alone in it. It is a part potentially of aging, and that you can correct it very, very often. Far more often than not, urinary incontinence is correctable. So seeking the guidance of a urologist, your GYN, and most certainly a pelvic floor physical therapist can really change the quality of your life if you find this to be very problematic.
Super interesting. There was a statistic that said that sort of I think it's like 1 in 4 women or something like that say they've never even brought up this issue to their doctor because they're even embarrassed to bring it up with their doctor. So I think normalizing the conversation, as you say, recognizing that this is biology, this is normal at all ages. Just understanding the biology helps us all a lot. And then, of course, the strategies you've given us today, super interesting that PT is a really effective tool for us. And of course, the other ideas that you gave us, and of course, the product. So really appreciate your time.
Well, you're most welcome. Great speaking with you.
Here are our top takeaways for today. Bladder leaks are common, more common than you may realize, and they affect women at almost every age. That's why normalizing the conversation around them is key. The many women with this condition need to know they're not alone. Second, there are proven strategies to help, from exercise and physical therapy for the pelvic floor to weight management to proper hydration. There are effective approaches that can help at every life stage. Be sure to consult your physician on the right plan for you. Third, products today offer real protection. Pads and liners made specifically for bladder leaks absorb fluid effectively and neutralize odors, allowing women to stay active and confident at every age. Thank you for listening, and please share today's episode with others in your life. For more podcasts from iHeartRadio, check out the iHeartRadio app, Apple Podcasts, or wherever you listen to your favorite shows.